The attendance for this year's conference will be probably fairly close to last year's number in the 44,000 range. What's particularly encouraging, though, is that the number of provider-based attendees is up about 18% over last year, with significant increases in executive levels, CEOs, COOs, chief medical officers, chief nursing officers, a sizable change in terms of those numbers that are coming to this conference. And what that's telling me is that the subject of technology truly has reached the C-suite. They're focused on it, and they're coming here to learn about it. Progress is being made in interoperability, but it is slow, in all honesty. We're not where we thought we'd be 10, 15 years ago when we really seriously embarked on this journey. The thing that I see, though, that I think is encouraging is a move towards what I'd call pragmatic interoperability, a recognition that we're never going to achieve interoperability at every level of detail. But what is important is making sure that we have interoperability at the places where it's absolutely critical, absolutely necessary. And I do see some significant progress there, where we are aligning systems and vendors along those things, those data elements, those settings that are really critical, and achieving some better degrees of interoperability. I think it's always a question mark when you have elections and you have the potential, well, this year it's the guarantee that we'll have a new administration. May be a different party, may not, but it'll certainly be a different administration. And that's going to result in some changes in health care. In technology, though, I'm not as concerned about seeing any dramatic changes in terms of the focus or the emphasis. Everybody has reached that point where there's an absolute recognition of the value of technology in healthcare, and there's no backing away from that. And so we're not really anticipating that we're going to see a dramatic reversal of the federal government's commitment to technology as being a part of the future of healthcare, but I think we all have to anticipate there will be some changes. The most significant issue that I think we're going to be talking about this week, and certainly the one that people are talking about most right now, is security. We introduced the Cybersecurity Command Center at the HIMSS conference last year. We've increased that in terms of its size and the content that we have in that pavilion. We've got a pre-session conference on day one on the subject. We've got sessions throughout the week. So security really is top of mind right now. Population health. As providers move from fee-based incident type of care to value-based care, population health is becoming a very significant component of what they're focused on. So again, we've got a pre-conference session on that and numerous other activities. Third thing that really comes to top of mind that I think is going to be very much a focus this week is patient engagement. The increasing consumerization of healthcare, the greater role that consumers are taking in managing their health care very much is played out in technology, and we're seeing that. We're putting programs together around that.